All right, guys, welcome back to Meet the Penis. And today we're going to talk about something that has exploded in our clinic over the past year. And this isn't erectile dysfunction, this isn't low testosterone, this is men. And honestly, couples coming in and saying, Doc, I feel healthier than I have in 20 years, but I don't want sex anymore. And almost every time now, they recently started GLP-1 weight loss medication. And here's what makes it confusing. They lost weight, their labs improved, they showed discipline, their blood pressure improved, diabetes improved. Everything medically is better, but their partner notices something first. The wife or the partner says he doesn't initiate anymore. The patient says, I love my wife or partner, I just don't feel sexual. That sentence right there, that is not erectile dysfunction, that is libido. Now, most people think sex drive equals testosterone. It's actually not true. I want to think of your brain like a reward center that also has a dimmer switch in a restaurant. Food pleasure, motivation, addiction, gambling, and sexual desire all share the same neurologic pathway, dopamine signaling in the hypothalamus. And these GLP-1 medications don't just shrink your appetite, they quiet the reward system, which is why cravings disappear. But sexuality is technically a craving. So what patients are experiencing isn't hormone failure, it's a neurochemical volume not being turned down. I explain it to couples like this. Testosterone is the gasoline, dopamine is the spark plug, and your tank can be full, but if the spark plug isn't firing, the engine doesn't start. And that's why these patients come in perfectly normal, great labs, and zero interest in sex. Nothing is broken, the signal just isn't being sent. And here's the important part. This does not mean you should stop your GLP-1 medication. For many patients, these drugs are life-saving for heart disease, obesity, diabetes. Instead, we treat the side effect and not abandon the treatment. This is where sexual medicine has actually gotten really interesting as of late. Because Viagra and Cialis treat blood flow, but these patients don't have a plumbing problem, they have a brain signaling problem. And medicine keeps advancing, especially with peptide therapy. There's a peptide called PT-141, very different from ED medications. It doesn't force an erection, it activates the arousal centers in the brain, the hypothalamus, the same pathway responsible for sexual anticipation. Patients describe it as, I feel interested again, I start noticing my partner, I actually think about sex, and importantly, it works for women too, which is why couples love it. So if your partner started a GLP-1 medication and noticed your relationship changed, you're not imagining it, you didn't lose attraction, you didn't suddenly age overnight. Your reward pathway was medically adjusted, and sexuality lies in the same circuit board. So modern medicine finally understands we don't have to choose between metabolic health and intimacy, we can have both. So I'm Dr. Alfie, this is Meet the Penis, and we'll see you next time.